First question is, a client is transferred from recovery room to a surgical unit undergoing a pyelolithotomy with the placement of nephrostomy tube. Which of the nursing action is least likely to benefit the client? Option A, calling physician to notify urine output is 20 ml per hour. B, turning the client from side to side to check for bleeding. C, teaching the client about dietary changes to prevent further stone formation. And D, straining the client's urine from both nephrostomy tube and urinary catheter. So the correct answer is option C. Immediate post-operative period is an inappropriate time for teaching on dietary changes for stone prevention. Henceforth, option A, B and D are incorrect. A client is diagnosed with acute MI and is on aspirin, lisinopril, then furosemide and potassium chloride. The client underwent some lab investigation and the values for the same are potassium 4.2 milliequivalent per liter, creat 2.3 mg per dl, platelet 250 Ka per ml. Based on the result, the nurse should plan to consult the physician before administering option A, aspirin, lisinopril, furosemide and option D, potassium chloride. So the correct answer is option B. For lisinopril should be used cautiously in client with renal impairment. Serum creat level is of 2.3 mg per dl is elevated and indicates renal impairment. The physician should be consulted before administering lisinopril. Option A, C and D are incorrect because these medications are safe to administer. Next question is, which action should be taken by a nurse when caring for a client who is expecting dyspnea due to heart failure and chronic obstructive pulmonary disease, that is COPD? Select all that apply. Option A, apply oxygen 6 liter per nasal cannula, elevate the head of the bed 30 to 40 degree, weigh the client daily in the morning, teach the client pursed lips breathing technique. So guess. The correct answers are B, C and D. Elevating the head belt will promote the lung expansion. Daily weigh will assess excessive fluid retention. Fluid volume excess can increase dyspnea and cause pulmonary edema. Pursed breathing will also allow the client to conserve energy and slow the breathing rate. Henceforth, option A is incorrect. Why? So the next question is, while performing physical assessment on a client with long-term history of tobacco use, the nurse should note the changes in the client's finger. फिंगर में कुछ चेंजेस दिखे हैं. सो इस इमेज में आप देखेंगे जो क्यूटिकल और नील का जो एंगल है वो चेंज हो रखा है. सो द ऑप्शन ए इज विटेलिगो, ऑप्शन बी इज क्लबिंग, ऑप्शन सी इज केराटिनाइज्ड एंड ऑप्शन डी इज पुअर कैपिलरी refill. So which of the following would be best? So the correct answer is option B, which is clubbing. So the nurse should document it as clubbing क्योंकि the picture shows swelling at the distal end of the finger and loss of the normal, that is 160 degree angle between the base of the nail and the skin. Clubbing results from oxygen deficiency and is often seen in client with congenital heart disease and long-term use of tobacco. Henceforth, option A, C and D are incorrect. So the next question is, an unresponsive client is admitted to emergency. Client's cardiac rhythm is extremely irregular with no measurable heart rate, no P wave, no QRS complex. A nurse leading the resuscitation team should direct the team to perform which of the following action? Option A, defibrillate. Option B, administer epinephrine. Option C, perform cardioversion. And option D, prepare the pacemaker insertion. Hence, the correct answer is option A. The client sign are characteristic of ventricular fibrillation. ना तो P wave है ना QRS complex है, heart rate भी नहीं दिख रही है. So henceforth we will go for defibrillation as the primary intervention. Epinephrine should be administered according to the advanced cardiac life support. After defibrillation, synchronized cardioversion should be performed on a client with atrial fibrillation or flutter. Next question is, when communicating with normally developed 2-year-old about to undergo a diagnostic test, the nurse would expect the client to communicate, option A, by pointing and imitating, option B, using at least 6 words, option C, in 2-word sentences and option D, using complete sentences. So इनमें से कौन सा ऑप्शन है जो 2 साल के बच्चे की कैरेक्टरिस्टिक्स? आंसर इज ऑप्शन सी. नेक्स्ट क्वेश्चन इज, अ नर्स इज केयरिंग फॉर अ हॉस्पिटलाइज्ड 10-year-old child who met roadside accident and is currently on room air. pulse oximeter is being attached and oxygen saturation is 84% and alarm is beeping. So the nurse should call the physician for ABG, assess client's level of consciousness and skin color. Option C, replace the machine and probe. Option D, administer oxygen via nasal cannula. So the correct answer is option B. The nurse should immediately assess for mental status and skin color. Nurse can quickly determine whether or not the signal tracking constitutes an emergency or if it is an artifact, right? So if it is an artifact in the pulse oximeter monitoring can be caused by altered skin temperature or client's finger movement. So the next question is, a client is admitted with tentative diagnosis of hepatitis. Nurse determined that the client statement should be consistent with diagnosis. Diagnosis के साथ statement match होना चाहिए. Option A, I have not been sleeping well because I have so much heartburn at the night that it wakes me up. Option B, whenever I eat dairy product, I have diarrhea for a few days. Option C, lately I have been short of breathing. And option D, I am a smoker but lately I can't tolerate taste of cigarettes. So the correct answer is option B. The correct answer is option B. Anorexia can be severe in the acute phase of hepatitis. Distaste for cigarette in smoker is characteristics of early profound anorexia. Hence, heartburn is at night is a symptom of GERD. Diarrhea after eating dairy product can be due to lactose intolerance, and increasing shortness of breath can be due to circulatory or respiratory overload. Next question is, a client is admitted with VRE in a leg wound. The wound is draining although dressings are covering the wound. To prevent the spread of the VRE, which is the nurse's best plan of action? A, assigning client to a private room. B, assign only one caregiver to the client. Do not allow pregnant staff to enter the room, and place negative airflow to the room. Correct answer is option A. Single client room are preferred when there is a concern about the transmission of an infection, and it is not practical to assign only one caregiver as the client will likely to require multiple caregivers throughout the hospitalization. VR is not spread to the pregnant staff at higher rates than to non-pregnant staff. Subscribe for more such videos.